Welcome to this week's edition of Freedom and Prosperity Radio, the weekly radio news magazine we put together here at the Virginia Institute for Public Policy so that you can have good, honest, straightforward conversation without the demagoguery. My name is Joe Thomas, and you can find out more about us at virginiainstitute.org, or you can follow us on YouTube and get the podcast history of this program with all of the archives of all of the interviews we've done. Peter Van Haur is on. He is the Chief Executive Officer of Vital Connect, and we find we have something in common here. Vital Connect is the creator of the Vital Patch, and it's being used to monitor at-home COVID-19 patients. I'm in Hackensack Meridian Health System, watching over my mother who has COVID-19, and I guess you just sent a bunch of your stuff there. How are you this morning, Peter?
Joe, yes, I'm doing well. Sorry to find you in the state that you're at, but if there's any comfort in it, or help is on the way, so to speak, and we have our technology actually shipping to Hackensack Meridian right now. Before we get deep in the interview, I just want to give a heartfelt salute to the men and women on the front lines in the healthcare system.
Amen.
Out there. As the rest of us are hunkered down, sheltering in place, they're running the other way and fighting this, what is a terrible virus. So many thanks to them. Thank you.
Heroism is often doing what you need to do when nobody else would even think twice about it. But Peter, talk about what opportunities Vital Connect and the Vital Patch can do for family members of coronavirus patients, people who are concerned with it, and people who get diagnosis but maybe perhaps aren't as acute as others.
Sure. And what we have, Joe, is a technology that finds itself in the marketplace of what's known as remote patient monitoring. And the original thesis of the organization was, how can we care for patients that otherwise would be in a hospital simply because they need observational care? And how can we care for them in the comfort of their own home, but still give them the watchful oversight by the healthcare system? And so prior to COVID, what we were doing is we were taking patients that were sick for a variety of reasons. They weren't necessarily in need of being in an ICU environment. They just needed to have observational care in a hospital in case their signs and symptoms of whatever the disease was deteriorated, and we could quickly recognize that they were going down the wrong path, and we could get them into the care that they needed.
Mm-hmm.
So we were taking patients and we were keeping them at home. They would wear our technology. They'd be monitored 24 hours a day, 7 days a week by a healthcare provider. And as we were watching the signs and symptoms of these patients, if the signs and symptoms began to deteriorate, we could quickly alert their caregiver and get them into the hospital where they needed that higher level of care.
Now, I can see this being a huge benefit for, what we're already hearing is, could be an overwhelmed hospital system.
Yeah, absolutely. So if you look at what COVID has done, there's really two burdens that have been put on the healthcare system today. One is just the massive need of available beds in the hospital, and secondarily, the economic burden. And just to touch on the massive need of beds, if you think about our technology, it's a Band-Aid size wearable patch. And inside that wearable patch is housed a very sophisticated biosensor. And that biosensor has the ability to monitor up to 11 key vital signs. And those are an ECG, so constant heart rate. We're watching heart rate variability. We have a respiratory rate monitor. We have a built-in thermometer, so we're constantly watching a patient's temperature changes. We can look at body posture, fall detection, activity. And then included in that as well, we have an oxygen saturation monitor, so that's the amount of blood in your oxygen. And we can also measure your blood pressure. So when you think about COVID-19, and the reason that physicians are hospitalizing these patients if they don't need an ICU, but they're hospitalizing them to continue the observation of their signs and symptoms, what they're looking at is 4 key areas. They're looking at changes in fever. So they're watching their temperature continuously. Fever spike is an indication of early deterioration of COVID. They're looking for persistent coughing. They're looking for your respiratory rate, so how many breaths are you taking, because they need to get oxygen into their blood. And then lastly, they're looking at their oxygen levels. It's known as SpO2, saturation of oxygen in your bloodstream. We have 4 technologies that do just that on that biosensor. So we're continuously taking the patient's temperature. We're continuously monitoring the patient's breathing rate. We're continuously monitoring for persistent cough via heart rate variability. With a coughing fit, so to speak, your heart rate is going to significantly spike. And lastly, we're constantly watching the oxygen saturation in the blood. But we're able to do this from the patient's home and remotely stream the information back to, let's just call it a command center, where we're separating the patients from the healthcare provider and also opening up a valuable bed.
Well, I've been, in hospital care on a couple of occasions, and those sound very much like the same, monitoring, stickers that the hospital would put on somebody in their care, only they're connected to big machines sitting next to the bed. How does yours connect to these monitoring centers?
Yeah, so that was the original thought back in 2011 was when you walk into an ICU or a typical hospital room, it can be intimidating. You walk in and there's all these monitors and there's beeps and sounds and wires and stickers and all sorts of poles with different apparatus on them, and it's expensive too. And the thesis of the company was, can we take all of that equipment and move all of that into a quarter-sized biosensor? And some really smart individuals that work for us in Silicon Valley, the founding father, Dr. Nursi Mazari, has patented over 100 inventions which has developed this technology. We successfully have done it. And so what happens is a patient has a tablet. It's a Samsung tablet, and they wear this patch on their chest. The information goes from the patch or the biosensor to the tablet, and then from the tablet it's streamed up into the cloud. The healthcare provider can see the information in 2 areas. They can see it at that tablet that's sitting, let's just say, on the patient's bedside table. They can look at it. It looks just like a small miniaturized screen that you would see in a nurse's station on a typical hospital floor. Or, since it's streamed to the cloud, if you go on the URL that we provide to an approved healthcare provider, they can log in, and up on their personal computer screen, they will see all the patients that are patched that they are responsible for in one landing page, so to speak.
Well, I know that our listeners are very privacy and Bill of Rights oriented. So what you were just saying there about the healthcare provider would have a login, because my next question was regarding HIPAA and how this deals with patient privacy. But it seems like if your healthcare provider gets a specific login, am I understanding it correctly, then nobody else can see your health records?
Yeah, so your physician that writes the prescription for this technology would be the person that would receive the ability to see your information. That's accurate. Number 2, we de-identify all the information into the cloud. So it would not say Joe Thomas. It would say patient 101. So in no way do we link the patient's name or identification capabilities to the patient's information. Everything is 100% de-identified. And then from a cybersecurity perspective, we work very closely with Amazon using their cloud and their firewalls and the security that they have around the information that we're putting in the cloud. It's also worth noting we have 8 different FDA approvals going on 9. We have one in front of them right now. Some of these approvals are in and around the HIPAA compliance and in protecting the patient's information. So spot on question. We take that very, 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 very seriously.
So how does this roll out, and Peter, because is it everywhere? You happen to mention, just by happenstance, the hospital my mother's in is just getting a shipment of these. How do they get into the hospitals around Virginia, or do they go in through the doctors?
It could be either way. So in the case of, we're currently working with 3 key centers in New York as an example, simply because that's been the eye of the storm, so to speak, in the epicenter. And we're working very closely with Northwell Health, which is primarily on Long Island, and a couple facilities in Manhattan. And then across the river, just over the GW, is Hackensack Meridian, and they have multiple facilities. And then squarely in the heart of Manhattan, Mount Sinai Hospital. And in the case of Mount Sinai, the efforts were driven by one key opinion leader, one physician that shepherds the process in leading the technology into the larger areas of the hospital. And then in Northwell's case, it actually was driven by folks that were appointed on what was their COVID-19 task force, which was CIOs, CEOs, high-level nursing physicians, and we were able to go through their COVID-19 task force. Anybody that has a desire to bring in remote patient monitoring to help these patients, number one, rehab in the comfort of their own home, and really don't discount the fact that we are separating the healthcare provider from these COVID-19 positive patients. And you're hearing a lot of these healthcare providers that just by statistics alone, if you continue to come in and out of the hospital and you're dealing with patients that are sick, eventually you're going to catch the virus. And so what we have the ability to do is to remove multiple COVID-19 positive patients from the caregiver, but we can still give them the proper care that they deserve.
Well, so Peter, COVID-19 is the phrase that pays, but at some point we will have VC Day, which is Victory Over Corona Day. And so, my feeling is this applicable to other afflictions then? Can we, just hold on to this technology and build on it, and so it's for lots of people?
Yeah, absolutely. I mentioned before, we do 11 different vital signs. We can remotely monitor 11 different vital signs. So if you think of disease states such as COPD, you think about sepsis, heart failure. These are massive amounts of patients that are at risk for potentially having fatal outcomes because of these disease states. And the way to prevent a potentially terrible outcome with these patients is to monitor them for the early signs and symptoms of deterioration. And so in the case of, say, COPD or sepsis, if we're monitoring the vital signs and we begin to see a downward deteriorating trend of their vital signs, we can quickly intervene before it's too late. And so we can certainly branch into many different disease states. We have many algorithms that are built and actually have predictive analytics. One study was just published in the name of the study was LINK, L-I-N-K, in the Heart Circulation is the publication. And our technology, coupled with an algorithm, showed that we could predict the hospitalization of a heart failure patient 10 days in advance of that patient actually needing to be hospitalized. And we reduced the number of patients being hospitalized by a very, very significant amount. So there's a lot of different ways that we could go with this technology. And I think COVID-19, for better or worse, was a catalytic event that put overall telemedicine on the map to stay. And certainly more and more people are going to begin using telemedicine. And we fall right in line with that type of healthcare, providing healthcare in that fashion.
What about somebody who would say, but we need these patients to stay off the street, and you're encouraging them to get out and get on the street? What about the idea that the hospital is the safest place for them to not be out in general population?
Yeah, I think it's just a responsible look at who the patient is and what disease the patient has, or what virus they have, or what the reason that the physician wants to monitor the patient for. On the flip side of that statement, there's a lot of data that's been published where patients, number one, rehab much better in the comfort of their own home. They sleep better. They're not constantly being woken up every 3 to 4 hours by a nurse that's rounding. We're able to monitor all of those things that you'd otherwise wake that patient up for. And so they're sleeping through the night, which is one major reason that they're rehabbing better. There's also a large number of patients, and it's monitored by the government, and hospitals are actually negatively impacted financially via penalties if the level of hospital-acquired infections are higher than a certain acceptable level. And so one would argue if the patient's not in the hospital, they're not going to get a hospital-acquired infection.
That's a great point.
There's a lot of reasons to get them out of the hospital, but if they need to be there for various reasons, the responsible healthcare provider will certainly make that decision.
Yeah, who wants to go to a hospital? It's where all the sick people are, right?
Exactly.
Well, I appreciate this. Where can people learn more about this before it gets to Virginia, Peter?
Yeah, so vitalconnect.com is our website, and that's vital as in vital signs, and vitalconnect.com. If you go to our website, you'll see a landing page as it relates to COVID-19. You'll see another page as it relates to our focus on cardiovascular disease. And there's a lot of information right there on our website where you can contact us, and we'll certainly get right back in touch with you about how we can help.
Well, thank you so much for joining us this week, Peter. And it's Peter Van Haur, CEO of Vital Connect this week. You have a wonderful week, and I hope everyone stays well in your world and your company.
Joe, thanks for having me, and best wishes to you and your family. Thank you.
Thank you very much. Coming up next on Freedom and Prosperity Radio, Senior Research Fellow and Director of the Equality Initiative at the Mercatus Center, Matt Mitchell, one of our favorites, on legislators and healthcare professionals and how they can work together on Freedom and Prosperity Radio next.